Medical news and research from University of Utah physicians and specialists you can use for a happier and healthier life. You're listening to The Scope. Throughout the history of medicine, the goal has been to provide the best care available for patients. 100 years ago, that was pretty simple. Dr. Donald Nicolay, Chief Medical Officer at Community Hospital in Grand Junction, Colorado.
Medicine has changed dramatically. It's come from the country doc with his black bag, which contained most of the medications and instruments available to treat any illness. And that physician was expected to care for whatever illness he came upon as he made his rounds through the community.
Medicine has advanced light years since those days, and it's much more difficult for one hospital to serve every patient's needs. Dr. Mark Breen, Emergency Department Director, and Dr. David Robbins, OB-GYN at Community Hospital.
We have several hospitals in town. However, even the largest of the hospitals in town doesn't offer all services that every patient may need.
Larger urban settings and university hospitals often offer services that smaller communities just can't justify having full-time or afford having full-time.
And even, with 155,000 patients in the Grand Valley, we still don't have unlimited medical care. And so there are certain elements of care that we can't provide.
That's why hospitals like Community Hospital in Grand Junction, Colorado, have partnered with the University of Utah Hospital to provide better care. Here's Chris Thomas, CEO at Community Hospital, during a press conference announcing the affiliation with the University of Utah.
Over the past 6 years, Community Hospital has made great strides at becoming a quality healthcare facility, an active member of our community, and we have been committed to collaborating with our physicians and business leaders. We are constantly looking for better ways to deliver health care in a more cost-effective manner, and this new partnership with the University of Utah only enhances our ability to deliver on our mission.
The formal affiliation agreement will provide patients guaranteed access to the specialized service the University of Utah offers, many times without even leaving the Grand Valley. Dr. Robbins and Dr. Breen.
Traditionally, patients would have to travel to a university setting for what could end up being a 10 or 15-minute consultation and then have to return if any treatment was necessary. Now, through this system, we should be able to have a provider who will be able to be informed ahead of time why the patient is going to be transferred or whether or not their transfer is absolutely necessary.
In the emergency department, we're talking about expanding the role of telemedicine, and so you'd have a patient that would come into the emergency department. They'd be evaluated by all our physicians, nurses, and staff here at the hospital, and so they would get the care just like they've always gotten care. The extension would be that we'd have a specialist available by computer, essentially, that would be able to see the patient, would be able to talk to the patient, would be able to interact with that patient and direct the nursing staff, direct the physicians to do other testing in the emergency department, and help guide that patient's care.
The affiliation agreement with the University of Utah will also provide a more structured way for Dr. Robbins and other physicians to refer their patients to more specialized care.
If that relationship doesn't exist already, it becomes the responsibility of the provider, the nurses, or the institution to try to find a center that will accept and a center that has services that we need. And frequently, it's not much more sophisticated than opening up a phone book. Knowing ahead of time that the services are available and the relationship exists already to make these referrals will make our lives and our patients' lives thus much easier when there is already a difficult situation.
CEO Chris Thomas and Chief Medical Officer Dr. Nicolay add that the partnership will also help Community Hospital provide even better care to their patients through collaboration and training.
And for us, I think it brings access to one of the best academic medical centers in the country. We're a small community hospital, so our ability to do research and look at best practices is limited. And so now with this partnership, we hope to really tie into what the University of Utah has been doing around really setting the bar for great health care.
The University of Utah has an excellent educational academy set up, and we're looking forward to be able to take advantage of that to keep our nurses trained to the highest level possible.
Dr. Nicolay reassures us this is not a takeover, it's not a buyout, but it's a partnership where the University of Utah supports the great work Community Hospital is already doing.
This is not a takeover. This is a very cordial association and relationship that will develop. And this relationship is totally for the good of our patients, to give them the best and the highest quality of care whenever possible right here in Grand Junction. And occasionally, for those complex illnesses, be sure that they're transferred to a facility that give them the best care when they get to that new facility.
We're your daily dose of science, conversation, medicine. This is The Scope, University of Utah Health Sciences Radio.